FiberStitch all-inside meniscus repair. Determine the depth of penetration using the laser lines on the tip of the FiberStitch and set the depth stop accordingly by depressing and advancing the tab to the desired setting. Penetrate the tissue to the desired depth. Roll the deployment wheel backwards to the hard stop to deliver the first implant. Roll the deployment wheel forward to the hard stop to load the second implant. Advance the needle tip through the tissue in the desired location and roll the deployment wheel backwards to the hard stop. Roll the wheel forward to complete delivery of the second implant. Upon removing the device from the joint, a suture loop and a loose end of suture will be outside of the portal. Outside of the joint, pinch all the sutures and gently pull to set the implants. Identify the suture loop. Use a probe or similar device to pull the loop suture to compress the suture anchors. Tighten the repair construct by pulling the single suture to reduce the tissue. Introduce a suture cutter to cut the suture at the tissue.